Cancer is not this single thing, right? It's this aberrant cell growth. So it's
the ability of a cell to decide that it's going to grow really starts at the surface of a cell. If you think of a cell simplistically as a circle, the outer surface is where the cells respond to stimuli, growth factors. There are receptors sitting on that surface that bind to growth factors, and then they start cascades of protein-protein interactions that ultimately this cascade of events send signals to the nucleus of the cell, which is sort of the command center, which tells the cell, okay, now we're going to grow. And so what happens in cancer is that often, instead of having a very carefully designed normal series of protein-protein interactions, starting with the growth factor receptor, what happens is often something's gone wrong. You may make too many of the receptors in the cancer cell relative to normal. So now you have too much signal starting it. So instead of having this signal that has a certain pace, now it's really getting lots of signals.
It's also important to keep in mind the relative risk for different things. Sometimes there are things that are a cause of cancer, but they explain very, very little of it. And it's on one hand, there's this huge relationship between smoking and lung cancer. I mean, it's huge. And other things like the connection between excess weight and breast cancer, it's there, it's significant, it's real, but it's very, very small. And so it's kind of talking around the margins. We can explain marginally what certain things do. And a lot of things that pop up in the paper or the news, you know, there might be some association, there might be some even a causal factor, but the sort of clinical significance of that is often not very useful.